Hello, it's Dr. Debra Durst, and I want to welcome you to the channel. If you are a return viewer, then I want to thank you. And if you're new to the channel, then I hope you enjoy the wellness and sexual wellness topics that we discuss here. Little history about me is I'm a double board certified physician, did ER medicine for greater than 20 years, and now I have a wellness and regenerative medicine practice. If you're on a journey to having better overall comprehensive wellness, and maybe even in non-traditional ways, then this is the right podcast for you. So please like and subscribe and enjoy the videos. Welcome to the podcast with me, your host, Dr. Debra Durst, and I have my special guest, Dr. Ibrahim with Biltmore Restorative in Asheville, North Carolina. He is a urologist and he had a fellowship in prostate cancer. So we've done a previous podcast on prostate cancer. So if you have not seen that, you'll want to check that one out. And today I'm going to welcome Dr. Ibrahim to introduce himself, and then we're going to talk about testosterone and prostate cancer and some myths surrounding that. So welcome, George. You want to say a few words?
Well, thank you so much, Dr. Durst. It's always a pleasure being on your show. I enjoy every minute of it. We need to do more of these in person.
Absolutely.
But I look forward to what we have coming up.
Absolutely. We always have a good time in person. And we've done some trainings together, vampire trainings, and I'll tell you what, the clinical staff that's in training has a blast. We're sometimes completely the opposite in personality on a topic, and it makes it very fun.
I think people enjoy the fact that we are coming at it from different angles sometimes, but for the same outcome. And because let's be honest, there's more than one approach in medicine, and my way is not always the best way, and yours probably is, but maybe not.
Or we
And
both
at the end
just
of the day,
have strong
yeah,
personalities and are going to definitely express it, right? If nothing else.
but you got way better teeth than
I
I'll ever
know
have.
that's
So
true. That's one of the other advantages I have is the teeth.
got it going.
You're awesome.
All right, what's our
Love it.
topic?
So we're going to do testosterone and prostate cancer. So you know this better than anyone. So if you want to go ahead and open it up.
First of all, I am, fellowship trained prostate cancer Duke surgeon, and I was one of those surgeons or urologists 30 years ago that would not give a man testosterone because I was worried about literally, these words are in the book that I will reference shortly, throwing gasoline on a prostate cancer fire potentially. My views have changed 180% because the knowledge has changed 180%. And that's key. So many providers, myself included, did not know the current education until the last 10 years. Testosterone used to be thought as the impetus of prostate cancer. It has been found completely to be incorrect. In fact, men with low testosterone levels have actually higher incidences of prostate cancer and worse prostate cancers. In other words, men with higher testosterone levels have less prostate cancer and less aggressive prostate cancer. Testosterone is not the villain, but if you pick up the phone book and you find a random urologist, just like me, 20 years ago, I would go, hell no, I'm not going to give you testosterone. And you're going to hear that from many urologists and many primary care providers, and it's wrong. Abraham Morgan Taylor from Harvard wrote a study years ago where he realized, based on a series of questions that were actually on our boards that contradicted each other, that showed that men that were not exposed to prostate cancer, to testosterone, had the exact same incidences of prostate cancer as their twin brother would that was exposed to testosterone. And then if you took testosterone away from men, they still had the same outcome as men that had testosterone. So at the end of the day, going through puberty is the impotence for prostate cancer. Testosterone it has nothing to do with prostate cancer as far as it being aggressive, worse, more likely to happen. I hope hopefully I didn't talk too much on that, but
No, I think that like to me, you have the scientific data and and again, I've read the Testosterone for Life book by Morgenthaler.
yeah.
I always called it Morgenthaler. I always got it wrong for some reason. But
Well,
anyhow,
and
and
I might have it wrong. I mean, I apologize, doctor.
I know, correct.
Yeah.
We're sorry if we pronounced it wrong. But again, great book and great chapter on that. And he talks about how he, kind of transitioned out and researched it, and found it not to be the case. But I think of it from a, practical standpoint. Is that if that was true, that prostate cancer was caused by testosterone, every guy that was in his teens and late
20s.
teens and 20s would have prostate cancer. So clearly doesn't make
Absolutely.
sense, right? So
Totally. So Morgan State is a academic facility that has a lot of autopsy studies that they have published. And there are quite a few young men in the studies that are found in their 20s and teens even to have microfoci of prostate cancer at their deaths, in their early 20s and teens. These are men with the highest levels of testosterone, but they don't have tumor growth. They just have microfoci. Yet the men who are dying from prostate cancer are at the end of the spectrum that have the lowest testosterone levels during their
correct.
lifetime. Men lose testosterone at a big rate. We peak at the age of 25. It's about 1 to 4% a year. So if you compound that by the age of 50, 100% of men are at 50% of their peak levels. By the age of 60, they're at 1/3. And by the age of 70, they're at 1/4. Yet it's their 50, 60, and 70-year-old men that are getting diagnosed with prostate cancer when their levels are lower than they've ever been in their life.
Right.
Prostate cancer is not caused by testosterone.
Now, is there like a saturation to, the level? Because I hear, above a certain level, maybe 200 being that level, that again, then there's no change in it. Is there such a thing?
You're losing me on this one. Saturation.
It like a
I mean,
saturate, like a testosterone level above, like below a certain
oh,
amount,
oh,
it
oh.
matters, but then
So
above a certain amount, it doesn't matter.
I tell patients, I go, here's what I'm really concerned about. I want to see the bad numbers. Is your estrogen going up too high? Is your PSA going up? Not because of testosterone, but just because I'm always watching the prostate cancer. Those are the big things. Their hemoglobin and hematocrit, because testosterone can raise your red blood cell count. That thing, it happens about 1 out of every 8, maybe 1 out of every 10 men.
Mm-hmm.
And if those levels are high, because too high of a red blood cell count could lead to a stroke or heart attack, then I have an issue. But lowering the dose of testosterone did not seem to change whether or not their hemoglobin or hematocrit red blood cell count went up. Those are just the 1 out of 10 guys that have to go give blood. That's all you have to do.
And
Give
for the
blood. That's the
side and
treatment.
for the side effects of optimizing
Yeah.
testosterone, and again optimizing
Yeah.
it in men that have symptoms, right?
Yeah.
And
Yeah. But if the guy wants to go above a certain level, I mean, drug dealers count on patients wanting, or not patients, but their customers wanting more and more and more. And a
correct.
lot of guys would just want more. And it's because the initial effect is pretty dramatic when you go from like a low level to a high level. But once you're up at the high level, then really going much higher is not going to change things. They're just you. So here's one of the questions on my physical exam or history form. We ask patients if they have a low libido. If they say yes, the next pop up is how many times a month are you having sex approximately? And then they get a range of drop downs, 0 to 4, 5 to 9, whatever. And typically you see a low number on an initial patient. After they've been seeing me, if you ask the same question, you will see a much higher number. So the person that was having sex 0 to 4, that's now having sex 11 to 15, is used to the fact that they're having sex every other night. And they just forget about that after 8 or 9 months, and they want more and more and more. And I'm like going, it's really not going to do much.
When it doesn't seem to me like I get that a lot from men, honestly, it's like they already almost know where they want their test level. I felt better
They will
here or
tell
I
you that.
felt better there. And the estrogen is the same way. You can give a spectrum, but some men like it on the lower side, some on the higher. It's so individualized.
Beautiful point. And this is something for people watching us, because there is no such thing as what should my testosterone level be or what should my estrogen level be. Think about it. Every woman is different every day of a 28-day cycle and every day of a 9-month pregnancy. And some women feel great at this time in their cycle and this time of their pregnancy. Men are the same way. Some men like, a testosterone of 800. Some aren't happy if it goes below 1200. That's up to them. As long as there are other numbers that can cause bad things, like estrogen or the red blood cell count, then I'll honor that.
And so, again, side effects being, the estrogen rises, you have symptoms with it, or your hemoglobin hematocrit, PSA, and again, urinary symptoms or symptoms related to,
Yeah.
prostate effect of maybe DHT conversion. So, but no, I agree. Like, I don't find men wanting more and more. I find that most men just like it on the higher side, and that becomes established with them, or they don't. And that estrogen is clearly dependent on the man because it could be low or high, and they'll tell you where they want it once you start treatment and customizing. But
Yeah.
so
And well, go ahead,
oh
shoot.
no,
Go ahead.
wow, no, I was just gonna say, so back to that, testosterone doesn't cause prostate cancer, and
It does not.
so really, it's keeping an eye on the PSA and digital rectal exam and screening for it, which is the important thing. So it's not like they have to
Yes.
fear testosterone. They just need to be screened on a regular basis.
They all have to remember is we're doing nothing but putting air back in the tire. You cannot take a you cannot draw blood from one of my patients on testosterone or not on testosterone, and the lab cannot tell you if they're being treated by me or you or folks that do what we do using bioidentical testosterone. It's the exact same hormone. There's no difference. It's what their testicles used to make, but used to make a lot more of when they were 25, and it's making a lot less of now that they're 70.
And again, erectile issues definitely increase with age with that lower testosterone. And so symptoms
And
matter, like sex drive,
well,
function,
this is the biggie.
energy.
They're not testosterone. I mean, excuse me. They're not um PDE5, otherwise known as maybe like
Deficient.
Viagra, Cialis, deficient
Mm-hmm.
when they're sick. They're testosterone deficient.
Correct.
When they were 25, they didn't have PDE5s in their bloodstream. They just had a lot more testosterone. So, let's go to the root of the cause. And if we still need to bring in some other help, we can.
Correct.
But you're not deficient in those pharmaceutical products.
And we say the same thing like when it comes to anti anxiety, depressants, or sleep, because it helps with all that too. It's a life force. And so they're not deficient in any of that as we get older. That zest for life just isn't the same. You hear that all the time. Well, it is after you're
Yeah.
optimized. And so it makes a huge difference. Life force for men and for women. And again, that, safety still not as well accepted in women, but, we're making strides every year, I think. Not us, but overall. I mean, we know, but anyhow, so it doesn't cause it. And again, when we're talking about that, just screening in our other podcast, but what you were talking about is again, prostate cancer is common. It is, again, present in probably most men when they die, but they don't die from it. But they do, it kills a lot of men and if they're not screened and treated.
We can't stress this enough. It is the second leading cause of death by cancer after lung cancer, period. Over colon cancer, which every guy is getting their guac done to see if there's blood for screening for colon cancer. prostate cancer kills more men than any other cancer except lung cancer. Period. End of story. That makes it a big deal. Just because a lot of men die with it in their body doesn't change the fact that just as many men die from prostate cancer as they do from as women do from breast cancer. And if breast cancer is important, so is prostate cancer.
I would definitely direct you to look at our other podcast, and we will link it in the description because it talks in depth on prostate, the incidence and diagnostics and treatment and all that. And so, and Dr. Ibrahim does a great job of going into detail with that. So check that one out. And so, again, when we're talking about this topic, I do still agree that there's a significant percentage of urologists that scare patients. But again, I feel patients are more proactive than providers when it comes to this. And so they read, they're on the internet and searching. And so.
And please, I want to tell the listeners or our watchers, I was one of those urologists that would say no.
Yeah.
I've changed my mind 100%, 180%. Now that I know today's knowledge, because what I learned 30 something years ago is so different than what I know today. And I respect the providers out there that still fear it, because I was one of them. I understand where they're going from it. I was one.
Yeah.
But I've learned what it's out there now. And there's a lot of things that have happened in 30 years and that you have to keep up with it. And it's different. What we know today is so different than what we knew 30 years ago.
And it just seems to me, again, I say this with, breast cancer in women, and I say it with men, like when it's highest, if it actually caused it, because we're using bioidentical, which is identical, if it actually caused it, then you would have it when your testosterone was highest. So just that, just common sense would make you doubt it. But now there's lots of evidence. And I think a good source, wouldn't you say, is that book, Testosterone for Life, as a starting point, because it's a very simple read. Yep. It's great as a starting point. And there's a chapter in there that talks about prostate or testosterone and prostate cancer. Good starting point, at least, if you don't know. And then take that to your urologist. And again, Dr. Ibrahim is in Asheville. I would love for everyone to leave their comments and experiences and any feedback. And if you want to deep dive into anything else, because Dr. Ibrahim is a wonderful source of lots of different, expertise in lots of different areas, and sexual wellness is one of them. I love having him on the podcast because he has a great way of expressing, complex topics and breaking them down for people to understand in a very easy way. It uses lots of, analogies and stories. You got any other stories for us you want to share today before we go?
Right. No. I won't have a good one for this one, but I'll come up with one.
No.
Always a pleasure. These podcasts with you, Dr. Durst, always.
It is always a good one. And we're gonna do one in person soon. And until then, I'm so happy that you joined me today. Share this with friends and with family members. And again, try to check out the link to the prostate cancer podcast because it has lots of great information. So it was a pleasure joining up with you today for this topic, and you have a wonderful evening. Anything else you want to, Dr. Ibrahim and Biltmore Restorative in Asheville?
Thank you.
All right. Thanks, George. Bye.